My name is Martine Elias, and I am the CEO of Myeloma Canada, which is a patient organization that is here in Canada. We're located in Montreal, and we serve all patients affected by myeloma. We are here today at the International Myeloma Society Conference in Toronto, which is very exciting for us as Canadian to welcome all the key researchers, patient organizations together under the same roof to talk about the exciting new research that's coming down the pipeline for myeloma. And we know as patients organization that it's been transformational, and that's so important for us. I'm here. I've been invited to speak, and I'm really excited, but also very nervous because it's one of the first times I think that, patients organizations are going to be on the stage for a presentation, and I'm going to talk about shared decision making. We know patients see things a little bit differently sometimes than physicians. We talk about, efficacy and side effects, but, they may be more important in the minds of physicians. But, when you're making a choice for a treatment, what's important for the patients could be totally different. It could be how far you live from a cancer center, what is going to be the impact on your quality of life, your family. So, you may want to make maybe a little bit different decisions, or at least consider what's important from your values in the decision that's going to be made for what's going to be your treatment. So that's going to be a really important conversation that we need to have here, but we need to continue to have more broadly with patients so that they can get engaged in that conversation. Sometimes we talk about shared decision making, and that's a big word because I don't think, patients sit down with their doctor and the doctor says, well, we're going to have a shared decision making conversation. That really doesn't happen. So it's really how you do it, giving the tools to patients to bring that conversation to the forefront is going to be really important. So hopefully we'll be able to create more interest and more knowledge around, what the patients want and how to make it happen. Knowledge is really important for patients to have when they go in and they meet with their physician. Do they need to know all of the clinical trials and the data and what drugs and, what's important, from a, side effect perspective? What they want is they want to live well and they want to live long. So it's the ability to empower patients, having the knowledge on how to have those conversations with their healthcare team is really important. So the knowledge is a little bit more about how do you position what's important for you, because you have a role to play as a patient in what happens to you in your life. I mean, every day you make decisions based on what's important to you. Making a decision about a treatment is also critical, and that's why you should be empowered to make the right decision with your healthcare team. It's how do you engage in that conversation with your healthcare team, your physician, and asking questions. I mean, being able to say, well, what is important to you, and understand what's important to you, because sometimes patients, the doctor is king, and they don't question, and they walk away from a meeting and they go, well, that's not really what I understood or what I really wanted. But they're just afraid that if they say something that they're going to sort of create an umbrage with your doctor, and patients don't like that. But, today's world with social media and the work that, HealthTree is doing, you're empowering patients to be able to have those conversations. You're asking questions. I'm seeing patients like yourselves, sort of interact and ask questions, and that empowers me to help educate other patients how to do this and connect patients together. So pairing, with peers is also really important.